Now, today, the full Senate is going to begin a discussion about one of the most challenging public health crises of our time, addiction to prescription painkillers and other opioids. In my home state of Vermont, there are few issues more pressing than opioid addiction. It's tearing apart so many of our families and communities I've known all my life. It was in March 2008, nearly 8 years ago, when I was chairman of the Judiciary Committee. I first held a hearing in Rutland, Vermont, about the challenges this epidemic presents in rural parts of our country. There's so many people that wanted to be there, we had to keep enlarging the venue where to hold the hearing. In subsequent field hearings, we learned about how communities like Rutland, Vermont, a beautiful community, were constructively seeking ways to get ahead of addiction. But we also learned, and I think we knew this, but we also learned there are no easy answers. And we need a comprehensive approach. Education, prevention, treatment are essential if we're to reverse the tide in this fight. Vermont's all-hands-on-deck example serves as a model for other states and communities across the nation. In fact, Mr. President, just last week, an article in the Christian Science Monitor detailed how Vermont's pioneering approach has been embraced well beyond Vermont's borders. So I asked for unanimous consent that the article titled in the Christian Science Monitor, titled "How One State Turned Its Heroin Crisis into a National Lesson," be printed in the record at the conclusion of my remarks. Mr. President, opioid addiction is not a new issue. It's not new to me, it's not new to Vermont. But it's about time that the full Congress gives this public health crisis the attention it deserves. The bill we begin to consider today, the Comprehensive Addiction and Recovery Act, or CARA, represents a positive step forward. I'm proud to be a co-sponsor of it. For decades, the knee-jerk response in Congress to those who struggled with addiction was misguided. We embraced harsh and arbitrary mandatory minimums. We ignored effective treatment options. We pushed addicts further underground, away from recovery. Such policies reflect a complete misunderstanding of the problem of addiction. When I held my hearings, everywhere I went, Mr. President, we saw police officers, faith community, educators, medical professionals, parents, and addicts coming together, saying no one group had the answer, but the community had to come together. Because we know addiction is a disease, we know our tools for combating addiction must be the same as for any other disease. A commitment to evidence-based education and proven techniques for prevention and treatment and recovery programs. As one who served in law enforcement, I know that law enforcement is an important element in a comprehensive approach. And that's why I worked to include in this bill an authorization for funding to expand state-led anti-heroin task force. But this legislation is important because it treats addiction as a public health crisis it is. The bill authorized a crucial program that I helped create that expands access to medicated assisted treatment programs that have been plagued by massive waiting lists. The clinic in Chittenden County, Vermont, that's the largest of our 14 counties, has seen its wait list lengthen to nearly a year. And what happens when that wait list is long? Several people have overdosed and died while waiting for treatment. Those deaths were probably all preventable. People shouldn't die waiting for treatment. We have to do better. But the bill also recognizes the devastating impact that opioid abuse has on rural communities. Just like, Mr. President, in your state and every other state, we have rural communities. But Vermont is predominantly rural communities. My home, where wife and I have lived since we got married, is on a dirt road. And we know rural America. And we know it's been hit hard by addiction. And emergency medical services in rural communities are often limited. So I'm glad the bill we reported out of committee includes my provision to support our rural communities with the overdose reversal drug naloxone. Over the last decade, death rates from opioid overdoses have steadily climbed every part of the country. But there's a real disparity between rural communities and major cities. What we found, Mr. President, that the more rural a location, the higher the death rate. Getting life-saving drugs into more hands will save lives across the country, especially in our rural communities that are among the hardest hit. Now, this is not a partisan issue. I thank Senators Whitehouse and Senator Grassley for working with me on this legislation in our Judiciary Committee. And I hope we'll soon see its passage here in the Senate. But one authorization bill by itself is not going to end addiction. It's not going to end the deaths that we're seeing in rural America and urban America. We need a significant commitment of targeted funding to implement this bill. Senator Shaheen's $600 million emergency supplemental appropriations bill provides those resources. I'm proud to be a co-sponsor of that legislation as well. You know, Mr. President, this is right now, your state, my state, and the other 48 states, right now. We've passed larger emergency supplemental bills to address swine flu and Ebola. Passed it to address Ebola. We didn't have Ebola in our country, but we passed an emergency supplemental bill to address that. We need to address what we have right here within our country today, because swine flu and Ebola presented far, far fewer dramatic health risks to our communities. We need to take this challenge just as seriously. The bill we're considering today has received strong bipartisan support, and deservedly so. But I hope that all the senators supporting CARA today will also support Senator Shaheen's legislation. One goes hand in hand with the other. We need to authorize these advances in dealing with the opioid crisis, but then we actually need to fund them. We can't pretend that solving a problem as large as opioid addiction costs nothing. We have an opportunity to equip our communities with the support and resources they need to finally get ahead of addiction. Programs will save lives. That's a worthy investment. You know, Mr. President, it's very easy to say we'll pass a law to stop opioid addiction. We can all feel good about voting there. Who's going to vote for legislation saying let's continue opioid addiction? But if we don't put the money in it, then basically we're saying we want to feel good, but we're not going to do anything for you. It's, you know, we spend money worldwide, some of it for good causes, some of it totally wasted. Here we have a problem in the United States of America. We're American senators. Our priorities are first and foremost to our country. Mr. President, if you saw some of the people I've heard in these hearings all over our beautiful state, some of the families I've talked with across their kitchen table, a young woman who had been addicted, now helping counsel others. And the story she told, if you saw it, a movie or TV programs, you'd say, well, it couldn't be that grim. Well, it was. It is. These people go across all income brackets, all brackets of education. It is tearing parts of our communities across the country apart. Fortunately, we've had some very brave people stand up. I hope Senator Shaheen's appropriation goes through, because if it doesn't, we're saying all the right things, as we should, except for one thing. We're not going to pay for it. This is too important to say the check's in the mail. Just wait and wait. We can do better, Mr. President. We can do better.